Dear colleagues, welcome to the OncoAlert Roundup for day one of the San Antonio Breast Cancer Symposium here in our hometown, San Antonio, Texas. Starting off with immediate breast surgery versus deferral in surgery in women over 70 years old with operable breast cancer. Patient-level meta-analysis of 3 randomized trials among 1,082 women. Immediate breast surgery combined with tamoxifen significantly reduces local regional failure, distant recurrence, and breast cancer mortality in older women with early stage breast cancer compared to tamoxifen alone, with the greatest impact on local regional progression occurring within the first 5 years. We move on to the Margot trial, a randomized phase 2 trial comparing neoadjuvant paclitaxel, margetuximab, pertuzumab, or TMP, versus paclitaxel trastuzumab. Here, margetuximab plus chemotherapy showed a higher but not statistically significant pathological complete response rate compared to trastuzumab in HER2-positive early breast cancer, with similar safety profiles except for increased infusion reactions and alopecia in the margetuximab group. The next trial is a PADMA study, primary results of the randomized phase 3 trial comparing first-line ET plus palbociclib versus standard mono-chemotherapy in women with high-risk HER2-negative hormone receptor-positive metastatic breast cancer and indication for chemotherapy. The PADMA trial demonstrated that palbociclib plus endocrine therapy significantly improves time to treatment failure and progression-free survival compared to chemotherapy in high-risk hormone receptor-positive HER2-negative metastatic breast cancer, supporting its use as a standard first-line therapy. We follow up with the Destiny Breast 06 trial, efficacy and safety of trastuzumab deruxtecan versus physician's choice of chemotherapy by pace of disease progression on prior endocrine-based therapy. The Destiny Breast 06 trial showed that trastuzumab deruxtecan significantly improved progression-free survival and response rates compared to standard treatment in patients with hormone receptor-positive HER2-low or HER2-ultra-low metastatic breast cancer who had progressed after endocrine therapy, especially in those with rapid progression. The next trial is the primary results of the SOLTI VALENTINE study, neoadjuvant randomized phase 2 trial of HER3-DXd alone or in combination with letrozole for high-risk hormone receptor-positive HER2-negative early breast cancer. The SOLTI VALENTINE trial found that HER3-DXd with or without letrozole showed similar pathological complete response rates to chemotherapy in high-risk hormone receptor-positive HER2-negative early breast cancer, but with fewer severe side effects and significant correlation between increased cell TIL score and treatment response. We finish off with a phase 3 Keynote 522 with an exploratory biomarker analysis. The study of neoadjuvant pembrolizumab or placebo plus chemotherapy followed by adjuvant pembrolizumab or placebo for early-stage triple-negative breast cancer. The Keynote 522 biomarker analysis showed that TMB and T-cell inflamed gene expression profiles were associated with improved PCR and EFS, with pembrolizumab plus chemotherapy outperforming chemotherapy alone in high-risk early triple-negative breast cancer patients across various biomarker subgroups. And there you have it, folks, your wrap up for day one of San Antonio Breast Cancer Symposium. We look forward to a wonderful day two and hope you enjoy San Antonio.